and getting hurt while using cotton swabs. So we decided to dig a little bit further into that story. We invited Dr. Asit Vora, the Director of Inpatient Pediatrics from Jupiter Medical Center, to be on our show with us this morning. Thank you so much for being here.
Thank you for having me.
And I probably am guilty of this myself. I've used cotton swabs. I do every morning. I'll admit it.
I think we all do.
It's just that feeling that you like to get the water out of your ear. And were you shocked by this study that found more than 250,000 children were injured by using cotton swabs?
I was shocked at the number. I mean, I knew that those types of things happen. I've seen those, in the emergency room, but over 250,000 kids a year, that's or over 20 years. I mean, that's a lot.
Is it permanent damage? What kind of injuries are being caused?
So you can see, things from just, like feeling like something's still in your ear to sort of hearing loss, which is the biggest concern that we have. Sometimes it can be permanent, especially if the ear's been perforated or there's a hole in it, and then no one has done anything about it for a while. But generally, the hearing discomfort will actually go away, so it's not a permanent thing.
Okay. What have you seen yourself at Jupiter Medical Center in terms of injuries?
So the main injury that we see is a perforated eardrum, so that they just went in too far, and they feel a pop, and then they have a lot of pain. So that's usually the biggest thing. But you can see just feelings of something stuck in there, bleeding, and then dizziness, those types of things as well.
So if we want our children to practice good hygiene, then what are some other ways that we can get that feeling of water out of the ears, or earwax out of the ears?
So the main thing you could do is really just kind of wrap either like a cloth or something thin over your finger and just kind of clean the outside part of your ear, because really the old adage of don't stick anything smaller than your elbow in your ear is true, because the ears are meant to actually clean themselves. So you actually don't have to use a Q-tip or anything to really clean it, because the body's way is normally to push the wax out, so that way if there's any debris or anything else like that in the ear, it comes out automatically.
And I've heard sometimes by using the cotton swabs, we're actually pushing the wax deeper.
Right, so you're basically packing it in, so that actually makes the hearing part worse, as well as the pain and dizziness and discomfort.
Should we go to the doctors and get checked out if we've been using cotton swabs?
I don't think unless you're having pain or dizziness or some symptoms of it, but generally if you can avoid Q-tips, I think that's the biggest thing, because especially with children, oftentimes they will imitate what they see. So when they see their parents or their older siblings use them, they think, oh, okay, this is what we do. And so that can be sort of a modeling thing to do at home as a first step.
Now I'm curious as to how the whole cotton swab clean your ear thing came about, because it's been around for decades.
Right.
It's interesting. Well, thank you so much for being here. Very important topic, believe it or not. Farron?
Good to know. I feel like I need